Hi there, and welcome to another series on CBH education pharmacy revision. So, what we're going to talk about today is digoxin. Okay, so digoxin is a drug that's basically used in congestive cardiac failure and atrial fibrillation. Okay, it has a negative chronotropic effect, which basically means it reduces the heart rate, and a positive ionotropic effect, which means it increases the force of contraction. In atrial fibrillation, it exerts its therapeutic effect by reducing conduction at the AV node, preventing impulses being transmitted to the ventricle, and therefore reducing the ventricular rate. Now, commonly side effects include arrhythmias, cerebral impairment, diarrhea, dizziness, eosinophilia, nausea, skin reactions, vision disorders, and monitoring. When you're looking at your drug interactions, yes, you've got amiodarone, calcium channel blockers, spironolactone, and quinine. But what's really key here is look, you've got to halve the dose with the amiodarone and the quinine. Okay, key contraindications include intermittent heart block or second-degree AV block. Now, monitoring is really important, and the plasma digoxin concentration. And one of the things that comes up in the DPHC exam from time to time, clinical practice, OSCEs, or even just generally when a patient is newly started on the drug, you have to make sure that the sample is taken 6 hours post dose. And that's what a lot of people tend to forget. Now, obviously, digoxin has narrow therapeutic monitoring associated with it as well. It's really important that this drug is monitored when patients are given the drug as well. Now, commonly, in terms of key concepts to help you with revision, we've talked about the timing of the sample after the dose. Renal function is really important. So basically, if you've got patients who have an eGFR of less than 30 mils per minute and they're on a dose of greater than 125 micrograms, it's really essential that this is closely monitored because the risk of digoxin toxicity is greatly increased. Okay, and then when we talk about therapeutic concentrations, this has been taken from the SPC. So basically, anything greater than a range of 2 nanogram per mil, okay, that basically means that there's an increased risk of having digoxin toxicity as well. You have to remember also digoxin has a loading dose, and we're going to cover the pharmacokinetics around digoxin in a later lecture. One of the also things that comes up with revision as well is you've got to make sure you understand its use in AF. You've got to make sure it's a cardiac glycoside as well, and also dosing in the elderly. So when you're looking at things like case studies, dose charts, and even extracts from past exam papers, this is where aspects of this digoxin does crop up in here. Okay, and then obviously we'll be presenting further lectures on other drugs in the series. Thank you very much for listening.